Hello, good evening, everyone. I am Gabrielle. I'm the voter registration manager in Houston. And just welcome to our Jolt Talk. We're going to be talking everything COVID-19 vaccines. I am joined today by two special guests. So first, I'll introduce our health community organizer from Texas Organizing Project, Sofia Sepulveda. Thank you so much, Sofia, for being here. I'm so excited to talk to you. And then, of course, our star volunteer, physician assistant, Maria Calzada. She's an infectious disease specialist with Metropolitan ID in Houston, Texas. So thank you, ladies, for being here with me. This is super exciting to talk about. So a little bit going more into detail about what we're going to talk about today. We're going to talk about the clinical facts of COVID-19 and the vaccines. We're going to debunk some myths and talk about the spread throughout the Latinx community and how it's adversely affecting Latinx folks. So I'm going to start with Maria. And so just real quick, we're going to go over the basics a little bit, give us some clinical facts. So how is SARS-CoV-2 transmitted?
This kind of went back and forth a lot whenever we first started talking about COVID, and now it's all been about vaccines. So just back to basics. Droplets is the major way that it's transmitted. So droplets just means coughing, sneezing, talking, singing, all of that. So that's where that 6 feet come from, because on average, that's how far people can spray, and you don't have to be able to see it. So it's just important to keep that in mind. That's the major way that people transmit. And it can also stay on surfaces for a while. So if someone coughs or sneezes on a surface, and then you touch that surface, and then you rub anything with a mucous membrane, like your eyes, your nose, your mouth, you can auto-inoculate yourself, even if it happens a few minutes later. And so that's why it's important about the hand washing and just kind of being conscious of where you do touch things and where you put your hands. And that's where masks come in handy, because it's not just you blocking what you expel out of your mouth, but it also keeps you from touching your nose and mouth inadvertently until you get a chance to wash your hands. So that's the major one.
Right. Yeah. And so today, and I'm throwing out a little audible, but I'm pretty sure you saw, right? Today we had President Biden come out and say that there's new regulations from the CDC saying that if you're fully vaccinated, you can be without a mask outside. And then there's a really cool graphic that the CDC came out with about who's safe, like vaccinated versus non-vaccinated. But thank you for going over the basics, because there's a lot of, when COVID started, there was a lot of uncertainty. Everyone didn't know how it was transmitted. I know I heard several things we just didn't know. But now, since we're almost a year into this pandemic, it's just super important to know how we can still, people who are not vaccinated can still get it, how it's transmitted, how to stop the spread. And I'm going to admit that I never washed my hands more in my life until 2020, and kept things clean, even things that I didn't even think about. So yes, thank you for that. Okay, so next question. What does it look like when someone gets sick with COVID? So I had COVID in December, and so did my whole family, but we had different symptoms. Everyone was not the same. And so, some people believe that you have to have a fever, like to have COVID, you have to have a fever, or you have to lose your sense of taste, and which I didn't. And so, yeah, what are some of, what does it look like when someone gets COVID-19?
So that's a good question, because it really does vary. And there are a lot of people who have no symptoms at all, especially a younger person like yourself. It's not unusual to have no symptoms or very, very mild symptoms. We have patients that do have a fever, and because fevers are objective and quantifiable and easy to measure, we're all checking fevers. We love to, zap people and check fevers. But in reality, that's not one of our best measures because a fever isn't, like you said, present in every patient. And it's also not very specific to COVID because we get fevers all the time for all kinds of things. The lack of smell that you mentioned and the lack of taste, while not everyone gets it, is very specific to COVID. So that's something that if you find that in yourself or in a loved one, a friend that mentions that, that's a big alarm. That is a stop, get away from people and get checked kind of thing. And even though you may not have any serious kind of symptoms that would put you in a hospital, if you want to be a good citizen, a good friend, and a good family member, and avoid getting others sick, if you suddenly cannot smell your candles anymore, or you're cooking and you can't smell your spices, that's a ding ding ding. Get that checked out because that's very specific to COVID. So other things that we see, shortness of breath, cough, not so much the runny nose, stuffy nose, and sore throat, although you can get that. There's some people who have GI symptoms and that sort of thing. And then the most common complication is the pneumonia. There are other complications. We see vascular complications that I'm sure people have heard about, and neurologic, dermatologic, all kinds of things. This has been a big learning experience for all of us. But primarily it's been respiratory. And as everyone heard about whenever the illness first came out with ventilators and whatnot. But that is still true.
Right. Yes. Like I said, when I had COVID, I actually lost my sense of smell for a long time. Like even afterwards, I didn't get it back to at least, I didn't get it back to at least 3 months, 3 months later. And I was really worried about it. And I was even like sniffing paint nail polish remover. I just like literally would like sniff it and just try to smell anything. And I was so terrified because we see some patients that are some people who've had COVID who it's up to a year and they still don't taste or smell. And I know that like that's in the rarity, right? Of I mean those people are the minority, but I mean this is like ties into greatly why we need to get vaccinated to continue to or to try to stop the spread of this disease that is affecting everyone. Is literally affecting everybody, but a majority of Black and Brown people. But also before we go any further, I completely forgot to mention, if you have any questions for either Maria, Sofia, or me, or or anyone, they're really the experts, but if you have questions, please put that in the chat. We will also put helpful resources that you can that you can use, helpful links, but we'll be answering any questions. But anyways, moving on. So smarter choices and assess risks and benefits. What are the high factors they talk about that are associated with severe COVID-19? Like we talked about respirators and you talked about respirators, and then you talked about like more serious illnesses like pneumonia. So actually, when my family had COVID, my dad was actually at the hospital for 5 days because he was starting to build up pneumonia. But we hear, I'm pretty sure every single person watching tonight, and unfortunately us, right, we know someone who had severe COVID or was in the hospital. And so what does that look like, and what does it look like, and what is it?
So I'll take the first part of your question first. So what are the risk factors for complications? So older age, and as a parent, that was a relief. Once we kind of confirmed that for the most part the kids were safe or relatively safe. And there are some syndromes that we did see and do see still in pediatric populations, but for the most part, the older you are, the higher risk you are. And some of the most recent numbers that came out, even though after vaccinations at this point came out, the most recent numbers from the CDC show that the highest growth in new cases are in 18 to 29-year-old women. The cases are still mild that for all of these new cases that have come out most recently. The newest numbers still show that the highest proportion of hospitalized and deaths from COVID are still in the 65 and up. So that has not changed. Risk factors for catching COVID or having the worst complications are still cardiovascular disease, diabetes, underlying pulmonary disease, kidney disease, cancer treatment that suppresses your immune system. And unfortunately, a lot of them are diseases of lifestyle or that are worsened by some lifestyle choices, diabetes, obesity, things like that, that can lead to hypertension, dyslipidemia, which is just, high cholesterol, basically. And so all of these predisposing conditions can lead to not just catching COVID, but catching COVID with symptoms and complications. Right,
definitely. And so there are lots of vaccines. We've seen 3 vaccines come out that are approved by the FDA and the CDC in the United States. There's one more vaccine that has not been approved by the FDA here. But what is protective immunity? Does protective immunity develop after SARS-CoV-2 infection? And like how long? What's the average? How does it last? Or how long does it last?
So we don't have a perfect answer for that, but what it looks like on average, and it depends on the person. So, and I think people rightfully get frustrated that nobody gives a straight answer for these things. But on average, we're thinking that once you have COVID, you probably have about 3 months of immunity, but there's no guarantee. The fact of the matter is that the worse your infection, probably the longer you have immunity, but there's no guarantee. And the type of immunity you get from having the infection, ironically, is not as good as what you get from the vaccine. So even if you have COVID, you still need to get vaccinated. And actually, as soon as you're no longer infectious, you're past the window of needing to be quarantined, get your vaccination done. There's no reason to wait. There's no health reason why you shouldn't go ahead and get vaccinated.
Right. So I just want to reiterate. So if you've had COVID, it doesn't mean, there's a lot of people who believe that if you've gotten COVID, you'll never get it again. But that's not true, right? That
is absolutely not true. Your risk is lower for a while, but we don't know for how long. And certainly as we continue to get more and more variants, these variants are spreading faster. If you were infected with original recipe COVID and the variant comes in, you may get that, or just once your immunity starts to wane. And while you probably won't get as sick, you still are a vector for, and for passing it on. Plus, if you're a person who got infected the first time, chances are you have some underlying health conditions that put you at risk to begin with. What you were talking about earlier, the long haul COVID syndrome, people who have long-term deficits. We have people who are losing memory, in addition to losing their sense of smell, losing their taste. They're exhausted. It's like a chronic fatigue syndrome. I mean, there's so many things that people don't think about, that even though they don't have moments of being acutely ill, they don't end up in the hospital. They think, oh, well, I'm not going to end up on a ventilator. I'll be fine. It's just a cold. If you're one of these people that unfortunately end up with long haul COVID syndrome and you're suffering for months, if not years, we really don't know how long these symptoms are going to last. you're going to wish that you'd gotten that vaccine to prevent that, because that's a lot of suffering for what?
Right. And so along with that, there are people who, very fortunate who have never gotten COVID, but do not want to get vaccinated. And they believe, like, since they haven't gotten it to this point, why get vaccinated? Do you recommend them still getting vaccinated?
Absolutely. They are getting to be, we're getting into a situation where, so I was vaccinated. I got my first shot of Pfizer, although I'm not on the board of anything. I'm not, I have nothing to disclose as far as that's concerned. I've no dogs in that fight. Whichever of the 3 available vaccines are available, go ahead and get it. But I got my first shot in December, my second one in early February, late January. Now I don't remember. Regardless. And so now that the CDC, like today, came out with even more guidelines. So as things are opening up, as I'm getting more liberties, which I'm really enjoying, you can tell when you're out and about that people are being more and more open. And if you're unvaccinated, you're going to be at more and more risk, because people are going to start to assume that the people around them are vaccinated. And so you're really, playing with fire. So yeah, definitely, we need the folks that have been waiting. If you're one of those people that were saying, okay, I'm just going to wait, I'm going to see, I'm going to let all these people, I'm going to see what happens. Now is the time. Now is the time. We got our vaccines. All your doctors, your PAs, your nurse practitioners, your nurses, your nursing assistants, your dentists, your chiropractor, your vets, everybody got their vaccine. So, go ahead, give it a shot. We're ready for the second wave of hesitant folks. It's okay. Go ahead.
Right, definitely. Please get vaccinated if you haven't. Also, so you mentioned the 3 vaccines, and then most places we can choose. Can you just go over the 3 vaccines? Because I believe there's some confusion on what's available here in the United States and what's been approved and what hasn't.
Sure. So the 2 that came out first here are Pfizer and Moderna, and those are the mRNA vaccines. And then the J&J, the Johnson & Johnson, Janssen vaccine, that's a virus vector vaccine. And I won't get into all of the technicalities of those, but I will say that you cannot get COVID from these vaccines. They are perfectly safe. They will not change your DNA. There are no chips, there's no tracking, they haven't been made with any fetal tissue or controversial, products. They are some of the safest vaccines that have been made. They all have the emergency FDA approval, and a lot of people are concerned about the fact that it's an emergency approval. And that's just because the rules of the FDA require that any drug that they approve has to be out and in use in like mass population the way it is now. It has to be out for a certain number of months or a certain amount of time before it gets the final official approval. And so that's going to happen. I mean, it's coming. So it's nothing, there's nothing weird about this. I mean, this is probably one of the most tested. There were so many studies. I looked into the database whenever they were looking for people for studies, and it was enormous, just here in Houston, huge. So, I mean, really very well studied and based on science that was pre-existing many, many years before COVID, because they were working on this for other reasons. It just came at the right time, for COVID. So
Right. Yeah.
I hope that answers that question.
Yes, I think it does. So going on to the next question. So what adverse side effects are associated with the vaccination? I mean, we've heard a lot of people saying that they don't want to take the vaccines because of the side effects, or so I took Johnson and Johnson, and right when they pulled they paused Johnson and Johnson, I've got so many text messages like, "Are you okay?" Like you took Johnson and Johnson. I'm like, "Yes, I'm fine. I'm fine." Unfortunately, those 6 or that there are people who didn't have great side effects to the vaccine, but I'm fine. But what are some adverse side effects? How can we debunk this so more people can get vaccinated?
So the most common adverse effects. So I pulled this up because this is a common question. So just like any vaccine, the injection site, irritation, inflammation, pain, and soreness at the injection site is the most common. And in our family, we had some people, feel like they got punched in the arm, usually the next day, and then it went away. And some people were like, tough guys, whatever, no problem. So that just depends. And it's just like the flu shot, or, for me, I would say that it was a little bit worse than the flu shot, and definitely better than like the tetanus booster. The tetanus booster always, I find those to be kind of harsh. Fever for some people, that seems to be pretty common, usually on the second day. Some people get headaches, fatigue, chills, some muscle aches, some joint pain, but they all seem to resolve within 48 hours. And then some people don't have anything. I mean, and some people worry that when they have a lot of side effects, and then some people worry when they don't have a lot of side effects. So I am impressed with the tracking system. And if when you get your vaccine, they didn't tell you to register with the CDC, there's something you can do on your app. You can look it up on CDC's website. It's Be Safe. And they will check in with you literally the day that you get your vaccination, the next day, every week for so many weeks. And you can just check in and say, if you're feeling okay, if you're not feeling okay, what kind of side effects you are having or not having. And I mean, they're tracking so much data, and the pause on Johnson & Johnson, the way that you brought up, I think is really good evidence of that. I was on a call today. The CDC had, they're called COCA calls, and they update clinicians all of the time on like the most up-to-date information. And yeah, so it turned out to be about 15 out of 8 million people that had this thrombotic event. So it was a very tiny proportion. In reality, they went over the numbers. This actual disease is going up in the population anyways, even apart from the vaccine. And so there might be some confounding variables there, but regardless, it does seem to happen in women, younger women under 50. But once they crunched the numbers, it was not even enough to say restricted to just men or just men and women over 50. They still have it open to everyone, but they do have that caveat. So I think you have to respect the fact that they're being so open about their process. They took the time, they're educating all of the clinicians, and I think that people can have a lot of faith that even something that's so rare, I mean 15 people out of 8 million, and they still took the time to stop and really think through and educate. So these are safe vaccines, and I think really worth moving forward, or at least talking to a clinician and a physician, someone you trust, to give it a second thought, even if before you had decided that you weren't going to get the vaccine, I think this is a time to stop and rethink your belief about that.
Right. And so all three of us are vaccinated. So I was really sick, but again, I had COVID, and just 2 days of being sick with body aches to me was way better than ever getting sick with COVID again, or infecting someone that I love or someone that I don't even know with COVID again. So it's 100% worth it to me. Sofia, did you get sick? Did you have was your arm numb or anything like that? Um, or or what side effects did you have?
I Yeah, I got vaccinated around 2.5 weeks ago. So I'm no 2 weeks actually today. That's when I got my second shot. And the day after I was super miserable, right? Like I didn't have a fever. I know that one of my coworkers who actually got vaccinated at the same time, she texted me, she's like, I have a low grade fever. And it's a low grade fever. It's not 103, 100. It's something around 99.9 to 100, right? So it's a very low grade fever. I didn't have that, thankfully, but I did have the body aches, the muscle aches, the fogginess, right, that I felt. But I much rather feel that for 24 hours and rest than having a lifetime of complications or even death with COVID-19, right? We understand, kind of like Dr. Maria Castro just said, right? Like we have people who have lost their memory even after they recover from COVID. People, like you said, Gabrielle, who lost their sense of smell, their sense of taste for over a year. Imagine eating something that you cannot taste. That would drive me nuts. Like I would lose so much weight too, like to be honest. And but you also have underlying heart, liver, kidney, lung conditions that will haunt you throughout your lifetime, right? Even heart conditions because of COVID. We don't understand why, or unless the doctor has more information. I'm not a doctor, right? But based on the information, we don't understand why COVID affects this part of the bodies. But we know at least 1/3 of the population who has gotten COVID-19 and recovers, they have long-term effects from the disease. So I will say, and I understand too, I want to tell my Black community, my Latino community, right, that we understand the fear based on the history of the United States, the way that we've gone through low-income countries or low-income neighborhoods and tested new medication, tested new ways to treat people without knowing really fully the symptoms long term, right? We've known that some Puerto Rican women had some vaccine given to them saying that it was polio. Turns out that they were not able to have children, right? So we understand the fear within our community. But I also want to mention, kind of like Dr. Castro said, right? Like this vaccine has been in the works since 2011, since the first SARS pandemic was about to come out, right? Like, so they already had a virus that they can look at. When COVID-19 came, they already had half of the DNA of the virus, so they were able to speed up their findings and create this vaccine, right? I also want to make sure that our people are not afraid to taking this vaccine, right? Like, again, it's better to just suffer 2 days of feeling really bad than having a lifetime of consequences on COVID-19.
Right. Thank you. So like I said, Maria, Sofia, and I are still here. We're vaccinated. We're not turning into zombies. We are.
We're not being tracked by our government.
Yes. So yeah. So thank you. Okay. On to the next question, Maria. So how have we seen SARS-CoV-2, which we call AKA COVID-19, but I'll let you explain it. But anyways, how have we seen it evolve?
So we've got some of these different variants. The B117 has become so common that, you know, they're actually using that terminology in the news and whatnot. So the B117 is the UK version. It's the one that, you know, the United Kingdom saw first, and I'm oversimplifying a little bit, but anyways, they saw it, named it, and it's the most common variant here, to the point that in some areas it's not the variant, it is like the main thing now. And it is about 50% more transmissible than the original. It's likely increased severity based on hospitalization rates that we're seeing. And we do have some treatment for COVID now in the form of monoclonal antibodies, if people have heard about that. And that helps neutralize COVID, but that's based on the type of the outer part of the virus. And that's also how our vaccines work. Well, with the variants, it alters that outer part of the virus, and these variants put us at risk of even the monoclonal antibody treatment that we have not working. So with the United Kingdom B117, that one seems to be okay, which is good news. We have one from Japan called P1, one from South Africa, B1351. That one that is from South Africa is more concerning. There seems to be a significant impact on monoclonal antibody treatments. So there's also California, there's Brazil, we're seeing more and more variants. What does that mean? That just means that the longer we have virus circulating, even if it's not causing severe disease in certain people. So let's say we've got a lot of our older population vaccinated, and it's just the younger population that's unvaccinated. And they're like, so what? I got a cold. Or so what? It's asymptomatic. Who cares? Who cares is that while the virus is running unchecked, it is given an opportunity to continue to mutate, because that's what viruses do. We saw this with HIV as it learned its way around our original therapies and it became more and more wily. You see this also with bacteria. If you've heard about antibiotic resistance, and I've seen this in just my 20-year career. And I'm a PA, not a doctor. But I've been with our practice for over 20 years, and from the time I started to now, I've seen an amazing change in just, the same patient populations, the same hospitals, drugs that I used whenever I first started are practically candy to some of the bacteria that we see. And so this is the natural evolution of a lot of these bugs. So we need to be aggressive about vaccinating our population so that the virus is stopped in its tracks, or it's going to continue to evolve, and we may not like what it evolves to. And if we ever want to get back to normal, we want to get back to school, back to work, get our economy back, get our lives back, we can't just kind of do this, halfway. We need to be very aggressive about it.
Yes. And so we have some really important audience questions that I'm going to ask you, Maria, before before we go to Sofia. So the first question is, does a person with asthma have a higher chance of getting COVID-19 than a person who isn't asymptomatic?
Probably not a higher chance of getting the virus, but definitely more risk once they get it. So they're not particularly at higher risk of actually catching it. But yeah.
Okay. And then the second question, what are the chances of getting COVID after receiving a shot? So I'm guessing they mean if they got the first, for an example, if they got the first dose of Pfizer, and what's your chance of getting COVID before you get your second?
Okay, so, well, it depends on how long after, but so between the first and second shot of the Pfizer and Moderna, I believe it's about 60 to 70% protection, so 30 to 40%. So you do have some protection after 2 weeks after your first shot, but it is really important to get that second shot. And on that, if you've gotten your first shot and you have missed your second shot, delayed, whatever, go ahead and just get your second shot. It's okay if it's outside the window. This is not like your kids, DPT, MMR, those other pediatric things. Go ahead and just get that second shot. It will still help. It's not what they studied. It's not the perfect, 3 weeks or 4 weeks, but go ahead and get the second shot. It's not too late.
Right. So the third question is actually very similar. Can I get COVID in the period between my first and second vaccine shot? And
Yes.
So the
Yeah,
same.
you can get it then, and you can, and the three of us, not good, but you can still get it after you've been vaccinated because it is not 100%. And that's the reason why we don't say, throw away your mask. It's about 95% effective, which is fantastic. But that means 5% of the population, that gets vaccinated, in theory, can get it. We're seeing less of that, and considering how people are very, very loud about getting COVID after they've been vaccinated, I think that we do know, but the numbers seem to be less than that, less than 5%. But yeah, you can get it. But when you get it, it appears to be much milder with no significant hospitalizations and definitely no deaths. So that's all the more reason to get vaccinated.
Which I also want to point out that today's decision of the CDC to get rid of the mask in public spaces, I would suggest to please still wear your mask just in case, because PA Calzada, I want to call you Dr. Maria Castro, Maria, like she said, right? Like we need to, we still have the chance of getting COVID even after a second vaccination. So yes, I know that it may seem safe right now to be in public spaces without a mask. Try to wear your mask and try to be careful because especially Latino and Black folks, we know that a lot of our communities live in multi-generational households, right? And so you might go outside, get sick, and bring it back home. And then you can put in danger the rest of your family.
Right. Definitely. And then there's one last question for you, Maria. I'm a woman younger than 50 and I'm taking birth control. Is it safe for me to get the J&J vaccine?
Yes, they actually covered that in the call today with the CDC, and they specifically because physicians had that question, and yes, they've cleared it for that and for other women who have kind of what we call prothrombotic backgrounds. So yes, they have done that. So I will say this, if you're everything, all else being equal, if it were me and I could get either one, and I know for a fact I'm going to come back for the second shot, I might go ahead and get the Pfizer or the Moderna if I'm a woman under 40, but it just seems really easy to get the J&J. So kind of have to balance out the convenience of the one shot and you're done. But yeah, they cleared it. So no problem with birth control pills. It's a good question.
Thank you. So I still want you to stick around because we still need your expertise. But is there one thing that you want to share, or like one message that, like, before we end this Jolt Talk today, that you want people watching to know?
Basically, I mean, yes, I'm a PA in infectious disease, but I'm also a mom. I'm a daughter. I'm a sister. I'm a wife. And not only have I been vaccinated, but my husband, my 17-year-old son, I've got a 14-year-old daughter that I cannot wait until they clear it for 12 to 15-year-olds. I'm just itching. Hopefully that'll come soon. My parents, my 93-year-old grandmother, everyone in my family, as the moment that they could get vaccinated. Anyone who hasn't been vaccinated is constantly harassed by me. So I trust this scientific breakthrough, and without hesitation. So I hope that, and I don't know any other physicians or clinicians that haven't gotten it. So your doctors, your PAs, they're all getting this done. So it's not a scam. There's no conspiracy. We know that it works. We know that it's important, and you know, we just want our patients and our communities to be healthy.
Yeah, thank you. And so speaking of conspiracies, so Sofia is going to dig a little bit deeper into that a little later, but thank you so much, Maria. And like I said, stay on because we need your expertise still. So Sofia, you are TOPS health organizer. And so, so since you've been on the ground and you are amazing at giving us knowledge about who can get vaccinated, and you've talked to so many people, like what have you seen on the ground, and like how has our community reacted to like this information about like you know, the rollout, the vaccines, getting back, just even getting vaccinated, you know, anything about COVID, like what have you seen?
Pretty much what Maria has said, right? I've seen a lot of hesitancy within our communities from getting vaccinated. Not only there is a lot of hesitancy, and again, I don't want to say that it's not with reason, it's with a very good reason, right? Like again, the history of the United States has shown again and again that our medical system has tested unknown medicine in people of color, indigenous people, Black folks, right? So it is very, very valid, their concern about getting the vaccine. What I do try to tell them is that, again, the vaccine is very well researched, that this has been an ongoing process since 2011. The moment that they found out about SARS-CoV number 2, they were able to release the way that the virus actually work, or the system of the virus, in order for the other doctors across the world to actually research and start working on a vaccine. So it's very safe, right? I also want to say that it's not only the hesitancy in our neighborhoods. I also see a lot of problems with getting registered to get the vaccination. It's a lot of hit and miss when it comes to the city releasing information about vaccination sites. There is a lot of lack of opportunities in transportation when it comes to our communities going to vaccination sites. So I was really excited in a way when I heard that Johnson & Johnson was going to be available, being that it's one shot. It doesn't require the refrigeration that Moderna and Pfizer requires. And my dream of all dreams is to start doing like a mobile vaccination site within low-income communities, communities of color who have no access to transportation, who is very difficult for them to access a vaccination sites, because we've seen in our cities how the COVID hot pockets are in the Black and brown populations in our communities, versus the vaccine distribution centers tend to be in more affluent and white areas, right? So it's no chance or no joke when we see that the majority of the people who are getting vaccinated in Texas and across the states is white and wealthier people. There was an article, I think about 2-3 weeks ago, about some wealthy folks from Mexico are even coming to the United States to get the vaccination, right? And we know that those folks in Mexico are not really indigenous folks. They're pretty much Spaniard folks, white folks, affluent folks, right, who are coming over here and taking away the vaccine that we should give to people who are on the front lines, that those essential workers, the grocery workers, the gig workers, right? So it's a lot of not only misinformation and fear within the community, it's lack of opportunities in our community in order to get them vaccinated. And we need to start addressing that, not just in a state capacity, because we know also that our representatives right now don't really do a lot for the Black and brown community, but it should be a work that we could get engaged all together to push our cities to do something. I know in Harris County, they're doing some work with Lyft or Uber in order to bring folks to vaccination sites. They're not doing mobile sites, but they are doing that, which is a big help. I don't want a person who is low income, who has high chances of getting COVID because they have diabetes, because they live in a food desert area where the only way that they can get sustenance is going through McDonald's, right? To get a 2 to 3 hour ride to a vaccination center, maybe exposing themselves to getting COVID in the way, right? So we need to start thinking of ways to bring the vaccination to our communities and doing education workshops in order to ease the mind of our people who have a right to be weary about the vaccination process.
Right, definitely. I mean, all of that is really important, especially, I mean, knowledge is power, and if our community doesn't know where to get vaccinated, I mean, how can they get vaccinated, right? And so, TOP is one of we're so happy to work with you guys. We love you so much. And so TOP actually on their Facebook shares where you can get vaccinated. And so, right, Sofia, I'm saying that correct, that you guys share that?
At first, we were doing it on our private groups within the Harris County, the San Antonio County, the Dallas County. We are going to start sharing that information now more openly because we've seen an increase of vaccines coming to Texas and a decrease of people getting vaccinated. So we have an influx of vaccine and we don't have people to vaccinate. So we are getting now text and information saying we have vaccines available.
Mm-hmm.
First come, first serve. Please show up. We are doing a lot of outreach within our members and trying to outreach our communities to let them know, hey, this is happening. Please show up at this location during this time, during these hours in order to get the vaccination. Again, it is what I want to drive today is like, if you see white folks, wealthy white folks without reservations getting their vaccine, that means the vaccine is safe. Why? Folks ain't gonna get no vaccine if they feel like it's not safe to get it. So let's make sure that our people who are in the front lines, again, those are the grocery workers, the folks who are working in the schools, the folks who are preparing our meals when we go get tacos in the morning, because we love tacos, we live in Texas, right? So we need to make sure that we get protected. And if you do have some sort of underlying condition which makes you rightfully afraid of getting the vaccine, make sure that your nucleus gets vaccinated, right? Like your husband, your wife, your aunt, your uncle, your grandma, whoever lives with you gets vaccinated, because that's how we reach herd immunity, right? Like we need to protect those folks who are the least likely to get vaccinated because they have underlying conditions, like we mentioned earlier, by getting everybody else around them vaccinated.
Right, definitely. So we talked a little bit about outreach. We know that our community is a bilingual community. We don't all speak English. We have Spanish speakers. How have you seen the outreach have you seen outreach in Spanish? For instance, like to me, when I watch TV with my dad who doesn't speak Spanish, and then I watch TV with my grandmother, it's totally different. I see more vaccination commercials or just, hey, there's more outreach to, like what I've seen, there's more outreach to English speakers than there is to Spanish speakers. Are you seeing the same thing? What more can be done and should be done to outreach to people who speak different languages? I mean, we know in the United States we just don't only speak English. There's I don't even, I'm pretty sure there's thousands different languages, but like there's hundreds of different languages. But like for our community who only speak Spanish, have we seen that outreach to them, and what more could be done?
Oh yes, like the language divide is really real. Like the language divide coupled with the technological divide is super real, and it prevents access to vaccination to our communities, right? Like here in San Antonio, where when I reside, the one of the clinics provides access to, I don't want to say the name, but one of the clinics provides vaccination, right? And it still shows that you need to put in your social security. There's no way that you can, there is no Spanish translation to the registration link. So not only is very, there is a lot of barriers from the communication side being that is in English rather than in different languages, like you mentioned, right? It's not just Spanish and English that is prevalent in Texas. We have many other languages. It's also the fact that they continue asking for a social security that they shouldn't be asking. And they say, well, you can fill 000 in order to get your vaccination because we are not really asking for social securities for our records. But imagine being a DACA recipient, a person from the immigrant community who is really trying to get their vaccination. And first, you see that the sites, the vaccination registration sites, are not in Spanish but are in English. And then when you finally are able to try to get registered, they're asking you for Social Security. So it can feel pretty defeating for our communities, right? And I always say, like, we're only as strong as our most vulnerable are. And if we are not protecting our vulnerable communities, then we're not going to be strong and we're never going to get over this pandemic. So we need to ensure as community organizers or community organizations, we are making sure that we are creating pamphlets in English and Spanish so we can start providing them to our communities, and our community members can start providing to their families. And I urge a lot of community organizations to start doing the same, right? Like to start posting information in English and Spanish, to start drafting flyers in both English and Spanish or any other language that you're working with. Again, English and Spanish is not the monolith here in Texas. We have many other languages, but if it's not coming from our government, which I don't think that it will come, right, then it has to start to come from our people. We've seen in the past how the Black Panthers created their own clinic in order to help their communities. Let's start thinking of something, maybe not that clinic because we still need the help from the doctors and the CDC to give us the vaccination, but let's start being proactive with our communities, which is, again, translating flyers, translating information, doing this amazing type of workshop on Facebook and having our families see it, because it's an education conversation that we're having in order to ease the minds of our community, right? So share this video, ensure that if you don't know an organization that is close to you, go to Jolt. I know Jolt has Austin, Harris, Rio Grande, I believe, Dallas, top we have San Antonio, Harris, and Dallas. There's other organizations that you can start reaching out to and say, how can we start working together in order to reach out our community, which is very vulnerable.
Right, right. So our offices are in Harris, Austin, and Dallas, but we do work throughout the whole state. But yes, we need to start outreaching ourselves, and I believe that's why, and thank you again for both of you for being on here. But we all three individually believe in our organization and in our work. We believe, like, if we're not out here talking to everyone to get vaccinated, then we can't expect our government or our states, especially our state leaders, to do this for us. We have to have those conversations with our family members or with our friends, and it might be a little bit uncomfortable. And I know, I'm pretty sure my Facebook followers who don't want to get vaccinated, or my Instagram followers who don't want to get vaccinated, are very, like, they probably don't look at my stuff anymore just because I mean, it's just, I believe, like, we all have, like, as Latinas, as Latinx, part of our community, like, we all have the responsibility of making sure that the people, at least right in our nucleus, get vaccinated, and then we outreach to other people. So everyone watching this, yeah, it is like, please don't just watch this and never talk about it again. Talk about it to everybody, even if it makes them mad. But one of the other things that we definitely want to address is the misinformation, right? We've all seen it. We've all seen, I can't tell you how many times I've seen memes just created on Facebook, or little graphics just created on Facebook that people are sharing as facts. Like, right, I mean, Sofia, you mentioned the chip, right? That the the vaccine has a chip, or that or just other things that have been spread throughout, especially throughout the Latinx community. But how can we address that, and what are some examples that you've seen?
I don't like and I don't want to laugh, right? Like, because again,
Yeah,
it's concerns are very real.
yeah.
But I want to put it in perspective. We have a smartphone that we carry with us 24/7. We don't even let it away when we go to sleep. This phone has a GPS tracker in it. So you are being tracked every day at every hour. Then you go into your smart car or your car who has a GPS, right? So you are already getting tracked on your GPS. You have a smart TV on your living room. Guess what? That has a GPS. The government doesn't need to have a GPS chip to track you when we have a device that we are very comfortable carrying with us 24/7, right? So there is no chips, there is no tracking in our in the vaccination in the vaccine. There is again, going to what Maria said earlier, there is the risk outweighs the benefits. 15 people have had the blood clot on their brains, right? The thrombosis. That's within the 4 million people who have been vaccinated. So it is the what is the risk? There is really not a lot of risk, right? So it's the benefits, it outweighs the risk. And if we want to go back to some sort of normalcy, I hate using the word let's go back to normal, because going back to normal to me is like continue struggling with low income wages, continue struggling with lack of healthcare, lack of infrastructure, go to prison pipeline. I want to start something better, right? Like, but if we want to have some type of normalcy, then we need to start taking this illness serious. It's not the flu. The flu doesn't kill 500,000 to 600,000 people in a year, right? It is definitely a much more worrisome and much more urgent to take care of. If you don't want to get the flu vaccination every December, January, that's fine. This vaccination will allow us to have some sort of normalcy. Going back to visit our loved ones who some of us haven't seen in a year and a half since the shelter in place started, right? Like, I haven't seen my sister, I haven't seen my brothers, I haven't seen my friends who I used to hang out with and go hiking with. And if we want to have a tamalada this December with our familia, then it is time to start getting vaccinated. We cannot have a good chocolate abuelita with our vecinas and our tias if we are not vaccinated. So it is very important to get vaccinated. And again, the benefits outweigh the risks. And it is time to start thinking, do I want to take care of myself and my family? Because it's not just about you, it's about you and your family, right? Like, we need to stop thinking about oneself and start thinking about everybody else, how we are affecting everyone else. So it's not just about you, it's about taking care of you, of your loved ones. And if you want to start having those visits with your tia who might be 90 years old, or your grandmother who's 95 years old, then let's get vaccinated. Let's get vaccinated, not just for you, but for your loved ones.
Right, definitely. Please get vaccinated. Okay, so one of the last questions that I have for you, which I think is one of the most important. So what are so for instance, there's a lot of people who believe that only citizens can get vaccinated. There's a lot of people that don't know that they are eligible for the vaccine. What are our rights when it comes to getting a vaccine, and who is eligible to get it?
Everyone who's over the age of 16 is eligible to get the vaccine. You don't have to have a social security. You don't have to have an ID. And if they do require an ID, I know in Harris County and in San Antonio, Bexar County, with Texas Organizing Project, we were able to push for library cards that are the same as state issue ID cards. And our elected officials push to ensure that they're being accepted, not only as a way of identification, but as getting a job or even renting an apartment, right? So this identification will help you get the vaccination. If you don't have an identification, bring a bill, something with your name. It doesn't have to be a utility bill, right? But there should be no cost. The vaccine is free for everyone who wants to get it. So if somebody is telling you it's $150 for the vaccine, they're more than likely ripping you off, and you need to report that with our public health department and let them know. If you've seen folks asking for Social Security very aggressively, which they shouldn't be, report that. We have the right to report them and have our public health official investigating this vaccine dispenser sites in order to ensure that they're accepting everyone who vaccinates.
Yes, yes. So everybody can get back. Everybody who's 16 or over can get vaccinated. So like Maria, Sofia, what is the one thing like that you want people to leave with, other than making sure that they get vaccinated? But what is something else that you want to share with people?
Yes, get vaccinated. And one thing that I want to drive through very clearly, right, is like this virus is not a racist virus. It affects Black and brown folks at a higher rate because we are the ones in the forefront. We are the ones who are teaching our children. We are the ones who are cleaning the houses. We are the ones who are bagging the groceries. We are the ones who are preparing our food, right? So if we want to continue ensuring that this economy is moving, we need to ensure that our people are protected, because at the end of the day, it is our people who make this economy go, right? Without, if you ever watch A Day Without a Mexican, you know what I'm talking about, right? Like there will be no way that that you can go to your favorite restaurant in the morning and get a taco if our people are dying and getting sick.
Well, thank you both of you for being on here. This is really, really important for our community, and I could talk to both of you all day, every day. But thank you, and thank you guys for watching, and we'll stay tuned.
Thank you.
Share the video, get vaccinated.